Good morning, and welcome to the Minneapolis-St. Paul Business Journal's first annual Healthcare Hero Awards. I'm Kathy Robidoux, Market President and Publisher of the Minneapolis-St. Paul Business Journal. 2020 was an unprecedented year. Healthcare workers have gone above and beyond in their efforts to fight a global pandemic while continuing to provide care for non-COVID patients. To honor their work, the Minneapolis-St. Paul Business Journal launched our first ever Healthcare Hero Awards, which recognizes Twin Cities individuals in healthcare for their outstanding work and commitment to the field, for putting innovation, care, dedication, and compassion to work to improve the human condition. We have an amazing program planned for you today, and I promise you will log off today inspired. Now, let's get started by thanking the companies whose support has helped make this event possible today, our sponsors. Thank you to our virtual table sponsors, whose logos you will now see on the screen. Thank you for your support. And now let's learn more about this project and the selection process. Understanding the depth and breadth of all the different fields in healthcare, we sought nominations in a variety of categories, from first responders to physicians, from staff members and executives to medical researchers, from health equity champions to health entrepreneurs. We limited the scope of eligibility to the Twin Cities 24-county metro area, but our readers responded enthusiastically. We received 115 nominations in our first year. Our panel of judges had a very difficult time limiting the number of honorees down to 20. So many in healthcare deserve the recognition for all they did this past year, despite the challenges and heartaches. Speaking of our panel of judges, we'd like to thank them for their time and insights. We could not have launched this project without them. Our 2021 judges were Monica Engel, Senior Vice President and President of Government Markets at Blue Cross Blue Shield of Minnesota, and she serves on the board of Women's Health Leadership Trust. Alexis Kochansky is the Director of Member Engagement at Medical Alley Association and has a master's in public health from the University of Minnesota. Dr. Raul Coran is President and CEO of the Minnesota Hospital Association and has over 20 years of experience in the healthcare industry. Janet Silversmith is CEO of the Minnesota Medical Association with over 25 years of experience in health policy and has conducted research in health disparities. Thank you again. Now let's meet our remarkable honorees. Our first honoree is in the first responder category. Congratulations goes to Angela Townsend, community paramedic at M Health Fairview. M Health Fairview's community paramedic program launched in 2018 with the goal to innovatively fill gaps in healthcare not met by traditional models. For most of the initial phase, Angela was the only community paramedic, and she has been the program's biggest advocate and shaper. When she sees an area for improvement or a new service to offer, she makes it happen. She recently proposed to leadership that the program should offer food boxes after she saw a growing trend of patients suffering from food insecurity. M Health Fairview is now currently in the process of adding this service to the community paramedic program. Prior to joining M Health Fairview, Angela was a 911 paramedic for 16 years. She was driven to community paramedicine because she wanted to focus on providing preventative and community-based health to possibly avoid 911 episodes. We asked our honorees to each answer a couple of questions so we can learn more about them. Let's hear what Angela has to say.
The best advice I ever received is that life is too short to work at a job you don't love. I am lucky enough to be able to follow this advice. My bright spot professionally this past year was being able to resume community paramedic visits in the home after having to work from home at the beginning of the pandemic. Personally, it was getting vaccinated and being able to hug my parents again.
Congratulations, Angela. Our next category is Healthcare Executive Hospital-Based. First up in this category is Jennifer DeCubelis, Chief Executive Officer of Hennepin Healthcare. Hennepin Healthcare named Jennifer as the new CEO in February 2020, and within 3 weeks, she was leading Minnesota's largest Level 1 trauma center and safety net healthcare system through the storms of a global pandemic. Using her experience as an innovative social services executive at the county and state level, Jennifer guided the system as it cared for high numbers of hospitalized, critically ill COVID-19 patients during the pandemic. Under her leadership, Hennepin Healthcare stepped up to serve the state's urgent need to track the spread of the pandemic by implementing molecular testing for COVID-19, becoming one of the first systems in the state to provide on-site testing. Jennifer leads with compassion, and that was evident in the extensive support network created for the system's 7,000 team members. From a pop-up store to provide quick meals and personal supplies for employees to take home, to mental health support and respite housing near the main campus. Employees' needs were met throughout the pandemic. Now, let's hear from Jennifer.
What's the best advice I've received in my career? It's to identify the problem, be the solution. It's easy to complain about problems, to point fingers, to blame others, and we saw a lot of that in our community in the past year. It is so much more rewarding and impactful to not just identify the problems, but to roll up your sleeves and activate solutions. You don't have to go it alone, but you do have to do your part. We all have levers we can pull to ensure better outcomes, no matter what your role is, your area of expertise, your level within an organization. We can all help get to solutions, and it takes all of us. And that's what I focused on, is taking my sense of responsibility and developing, activating, and being a part of the solutions for a better community. It was seeing the resiliency, the teamwork, and the commitment across our organization, across Hennepin Healthcare. Our team members rallied for our community. They rallied with our community, and they created healing as a priority. At the very lowest points, our team members cared for each other. They advocated for patients. They supported the community, and they never gave up. True servant leaders and true healers. They created an incredible sense of family when we all needed it most, and they built bridges to health equity when it mattered the most. They inspire me every day, and I'm grateful to call them colleagues.
Thanks for sharing, Jennifer. Our next honoree is Dr. J. Kevin Croston, CEO of North Memorial Health. Kevin has been with North Memorial Health for the past 28 years and has served as CEO for the past 6 years. Prior to the COVID-19 pandemic, he championed a rebranding of North Memorial Health that focused on service to its customers. He also worked diligently to spread that messaging to his employees at all levels. North Memorial Health is a Level 1 trauma center that is a major provider of care for COVID-19 patients at all levels, including ICU. Under Kevin's leadership, the company focused on care before profitability. Let's learn more about Kevin.
Well, I believe that crises reveal the soul of an organization and the type of leadership that you have. And I would tell you that the bright spot for me this past year was seeing how everybody in this organization performed. We spent our prior years training for moments like this and preparing for things that we thought would never happen. And then when they did, everybody responded. Everybody showed up every day with a commitment and passion that I've never seen. And I would tell you, my bright spot every single moment was walking in every day and seeing everybody heading to work and trying to do the right thing for our customers and patients and for each other. They were supportive of each other, and they took risks when we didn't know what we were doing for them. And all the noise about all the things we didn't have went away, and they just came and performed. It was moving for somebody that's in my job to see that kind of response. Yeah, it's great. Remember that happiness is your key. You have to figure out how to get there. And I always say this to all of our people that start. Healthcare is a career. It's a calling. It's not just another job. And you have to have the wherewithal to understand that you're going to have the opportunity to make a meaningful difference to somebody every single day that you arrive at work. So I would say be empathetically human. Be real. Show up. be nimble, be resilient, learn to adapt. The most successful leaders know how to coach. They know how to listen to their people and respond to it in a way that's meaningful to them. They know how to deliver a difference when it matters, and they know how to pivot when they see the world differently. So bring fresh eyes every day and come with a commitment to making a difference, and the rest of it will take care of itself. This is a great career and it's a great job, and nothing highlights that more than the opportunity to make a difference during a pandemic.
Congratulations, Kevin. Please help me congratulate our first honoree in the category of Healthcare Executive Non-Hospital Based, Brian Lindberg with Be the Match. As Chief Legal Officer, General Counsel, and Chief Policy Officer at the nonprofit organization, Brian leads legislative and policy-focused initiatives. For the past 15 years, Brian's leadership in this area has ensured that Be the Match remains fully able to pursue its mission of achieving equal outcomes for all patients. Brian led the initiative at Be the Match to secure the only waiver on the U.S. travel ban that was put into place at the beginning of the COVID-19 pandemic. The waiver allowed couriers to transport life-saving bone marrow from donors to patients. Let's hear what Brian has to say.
So with a combination of work from home and distance learning, my kids have been able to see in person some of what their dad does on a day-to-day basis. Now, sometimes that's not too terribly exciting, boring lawyer stuff, but as National Marrow Donor Program was working to do seemingly impossible things, I think of an instance where we needed to move donated bone marrow out of a fully locked down country of Colombia, where if we failed, that meant that a patient here in the US was certainly going to die. My kids lived that along with me, and they cheered when we made what was seemingly impossible possible. Those have been incredibly proud moments for me. When I think about what has been my biggest professional accomplishment, I really think it's just been being a small part of National Marrow Donor Program's response to the pandemic. Having to collect stem cells from a volunteer donor, who are the true heroes, by the way, with COVID running rampant, and moving those life-saving cells from wherever they were in the globe to the bedside of a patient, wherever they happened to be across the world, all while airlines shut down more than 90% of their routes, entire countries close their borders, people subject to mandatory quarantine, a whole host of otherwise seemingly insurmountable obstacles. Well, it was astounding. All while a patient is desperately awaiting those cells and unfortunately will die without them. And only a 72-hour window to make all that happen. And then having to do that thousands of times over the course of the pandemic without ever failing, not even once. The people that I have the privilege of working with are amazing. And what they've done is, in my mind, near miraculous.
Great work, Brian. Next up is Charlie Mandilli, Executive Director at HealthFinders Collaborative. Charlie is a visionary leader who has grown and strengthened HealthFinders Collaborative for the past 10 years. Founded in 2002 in a church basement, HealthFinders Collaborative is a community health clinic that strives to ensure healthcare access for all. Charlie has led the expansion efforts at the nonprofit into 2 locations, one in Northfield and one in Faribault. In the past 14 months, HealthFinders never closed to its patients and remained in constant contact with them despite the uncertainty and confusion caused by the global pandemic. The company also launched a new virtual visit program, which allows patients to visit with their provider from any remote location using a smartphone. Welcome, Charlie.
This last year is really what it was all about. Helping people in situations and times when they needed them most, and oftentimes when they had no other option. People in healthcare are the folks that run the other way in the face of crisis. And that really, as if it wasn't true before, it was more true than ever this year. our clinic director, nurse practitioner, decided to become a nurse right after September 11th, 2001. And this year, just as that was, is another powerful example of the passion that brings folks to this work. What helped me get through this last year in times of challenge was my team. This entire crisis brought us together in a way that I will never forget. The way that we really just gelled and everybody knew exactly what their role was and what they needed to do. Also in the way that we supported each other, just in the way that we needed it and we needed each other to do, I think really is what got me through this, and I would not be here today without all the folks around me. Coming out of this, we are without question stronger because of it.
Congratulations, Charlie. Our next category is healthcare practitioner, non-physician, and first up is Erin Pomerantz, a registered nurse case manager for hospice home care with Allina Health. Erin's role as a hospice nurse has never been more important or more challenging than during the pandemic. Many family members were unable to physically say goodbye to their loved ones, and as a result, Erin assumed a new role of facilitating phone and video calls to say their final goodbye. In order to process these new circumstances, Erin turned to poetry. She wrote a poem called COVID-19, which was broadcast on TV, radio, and podcast networks such as Good Morning America, WCCO, NPR, and the End in Mind Project. This poem spoke to the tragic reality of the virus and how much grief families and healthcare workers have experienced. Let's learn more about Erin.
I'm a hospice nurse because I enjoy providing hope. Hope to my patients and their families at end of life. It might be a different kind of hope than what we are used to in the medical community, but it's still hope. I educate and empower families in how to take care of their loved ones at home. And I also work with my patients to ensure that they have quality of life, free from pain and anxiety, surrounded by their loved ones. The bright spot for me professionally has been using my writing and my photography to inspire others and give comfort. I wrote a poem called COVID-19 that my employer put to voice and video. And in it described the grief that we feel as healthcare professionals providing care throughout this past year, and also the grief of a loved one saying goodbye to their family over the phone, which many of our patients did this past year. I also used my photography in my hospice work to capture moments between my patients and their family members. Hopefully these will be keepsakes for their families. The end of life can be a really beautiful journey full of love and healing and forgiveness, and my goal was to capture those moments. The bright spot for me personally was my two boys, Ben and Nathan. They've given me lots of smiles and laughter through the heaviness of this past year, and I'm just grateful to be their mom.
Thank you, Erin. Our next honoree is Laura Triplett, a registered nurse at M Health Fairview. Laura has been a registered nurse with M Health Fairview for the past 21 years. As a critical care nurse, Laura volunteered to be moved to Bethesda Hospital at the start of the pandemic, knowing it would be a hub for COVID-19 care with the M Health Fairview system. At Bethesda and later at St. Joseph's Hospital, she worked on the front lines in the ICU. While facing daily grief and trauma, she found the strength and creativity to go above and beyond for her patients and their families. Laura took it upon herself to create a new initiative by sending patients' heartbeats home to families. She printed electrocardiogram strips of deceased patients' last heartbeats, rolled them up neatly inside of glass jars, tied a heart token around the lid, and sent them to families along with a handwritten note. Here's Laura.
I do what I do, first of all, because as a kid, I always, looked up like, oh, I want to be a nurse. So I became a nurse and then found that I really love nursing. I love helping people get better. I love helping people in their last days. I love helping family. It's just a very rewarding job, which I never thought of that as a kid. But as an adult, I found that being a nurse is actually really wonderful. When you look at the past year, if you look past the headlines and the news and the media and everything that's going on, and you really look deep down with everything that's happened this past year, you've really found that there is good in everyone and everybody's helping everybody out and supporting everybody through all of these hard times that have all happened at the same time. And and even found that the simplest little things, like why I'm here, just sending one little heartbeat, meant so much to somebody, is why we do what we do. And is a little positive to find that even that small, simple thing that you help somebody out really means the world to someone else. So thanks.
Thank you, Laura. Our last honoree in this category is Jennifer Lemire, Director of Integration and a registered nurse at St. Croix Hospice. Jennifer has been with St. Croix Hospice for over 7 years, most recently as Director of Integration, where she welcomes newly acquired hospice agencies to the St. Croix Hospice family and leads them through the first several months with the agency. When the COVID-19 pandemic erupted in early 2020, Jennifer's talents were tapped to help create and manage the St. Croix Hospice Vital COVID-only clinical teams with exclusively served COVID-19 positive hospice patients throughout the Twin Cities metro area. Even with so much unknown about the virus, Jennifer immediately began leading the frontline clinical teams to ensure uninterrupted care for the patients most endangered by the pandemic. And she increased support for partner facilities, which were initially epicenters for the spread. Jennifer also led the St. Croix Hospice care teams that worked exclusively in facilities which were experiencing significant COVID-19 outbreaks. Now let's hear from Jennifer.
The best advice I've ever received is to always ensure that the patient and family are at the center of everything that we do. Working in hospice, there is a misconception that end-of-life care is really sad. That's not necessarily true. Working as an interdisciplinary team, we can surround the patient and family and help bring joy to the journey and their end-of-life experience. Looking back on 2020, the bright spot would be working with an incredible team of healthcare workers who continued to provide the best hospice care to our patients despite all the obstacles that were set out before us. Working together to continue to provide care to our patients and families through new and innovative ways, and continue to provide support to our facility partners along with our patients and their families.
Thank you, Jennifer. Our next category is Healthcare Staff Member, Non-Clinical. Please help me congratulate Jennifer Krebs, Senior Area Director at Lutheran Social Services of Minnesota, and Sandy Hagel, a former Area Director with LSS. In preparation of COVID-19 positive clients in their residential service locations, LSS leaders developed a special support program called Healthy Heroes. Healthy Heroes are staff who commit to either 12 or 24-hour shifts to limit the number of individuals coming in and out of facilities with the goal of limiting exposure to and the spread of the coronavirus. When a resident living in a group home received a positive COVID-19 diagnosis in late March 2020, Jennifer, who has been with LSS for 27 years, and Sandy immediately packed their bags and arrived at the home within 3 hours. LSS's first healthy heroes, Jennifer and Sandy, lived apart from their own families for 2 weeks to assure the health and safety of individuals in their care. Following this experience, they improved the organization's COVID-19 policies and procedures. Please welcome Jennifer.
Lutheran Social Service of Minnesota supports individuals with developmental disabilities who need daily supports to live independent lives in their own homes and community. I choose this field because I want to help people and support them in living the kind of life that they want to live. Sometimes it seems like people with disabilities have their path set for them without their input. My job is to help them figure out what they want to do in their lives and what supports they need to get there. Where do you want to live? Where do you want to work? What do you want to do for fun? And what types of supports do you need? These are the questions that I ask and help them answer. This career is incredibly rewarding. There are new challenges every day, and my job is a lot of fun. I can't think of a day when I don't smile at work. I get a chance to see people creating the type of life that they want and the ultimate success story. The bright spot of this past year has been seeing the staff and the people we support overcome each challenge we face. Now we know how resilient we are and that we can get through hard times together. When the pandemic began, everyone was unsure and didn't know what was going to happen or where this world was going to be. People were scared. When we had the first person supported in a residential setting test positive for COVID, we all came together immediately. We had put so many plans together for staff and individuals to keep everyone as safe as possible. We all came together with the same mission in mind. Once we developed the plans for how to support COVID positive people in their homes, I felt a lot more secure, better equipped to help others who might test positive in the future. Now we know what to do, what we need, and we've implemented these plans many times throughout this past year, and we know what we can do.
Awesome job, Jennifer and Sandy. Our next honoree is Alex Leal from M Health Fairview. Alex served as a health unit coordinator in the medical, surgical, and ICU units at M Health Fairview Bethesda Hospital after the entire facility was converted to the state's first dedicated COVID-19 hospital. While carrying out his day-to-day responsibilities, Alex also created the COVID-19 Bell, a symbolic way for recovering patients to celebrate as they were discharged from the hospital. As each recovering patient left the hospital, Alex and his coworkers gathered in the hallway for a happy send-off. During the send-off, they would hold out the bell for the patient to ring. The Recovery Bell idea has spread beyond Bethesda Hospital. Several other hospitals in the M Health Fairview system adopted the concept, and the original set of bells is still in use today at the COVID-19 care unit at the St. Joseph's campus. Alex has been with M Health Fairview for the past 3 years. Let's learn more about him now.
Well, every time the COVID bell rang, the recovery bell rang. That was huge. That's why it was made in the first place. Being able to take part in those moments of patients finally triumphing and being able to go home to see their families was a huge win for us as staff, for the patients themselves, and for their families. So that's definitely top of the year. Probably second then would be getting the first dose of the COVID vaccine. That was amazing. The amount of hope that it brought and the feeling of invincibility almost and success really showed that there was light at the end of the tunnel. That was wonderful. Well, first, remember that choosing to enter healthcare is choosing to serve. It's not about you. You're choosing to serve your patients. Now, secondly, I guess, even though you're choosing to serve, you have the opportunity to be a leader every single day. It doesn't matter who you are or what position you were hired for or what your credentials are. You have a palpable influence on your workspace and those around you and your patients. So work to be a leader and cultivate an atmosphere of collaboration. The more you are willing to go the extra mile to help your coworkers, the more they will be willing to help you out, and together, the better care you'll be able to provide for your patients. Third, and finally, never lose appreciation for the amazing work being done. Working in healthcare is incredibly rewarding, and it's also incredibly taxing. And unfortunately, it's all too possible to become jaded after working in it for a long time. And in doing so, you sort of forget the simple wonders of science and medicine and the healing of the human spirit. But it's important to occasionally take time to step back, reflect, and realize and recognize and delight in the simple wonders that you're seeing every day.
Great work, Alex. Our next honoree is in the Health Entrepreneur category. Please congratulate Kurt Waltenbaugh of Carrot Health. Kurt is harnessing the power of data to improve healthcare for all. He is founder and CEO of Carrot Health, a software company he launched in 2014 that analyzes consumer healthcare data. He believes that information can and should be used to eliminate the barriers keeping people from leading healthier lives. With the arrival of COVID-19, Kurt oversaw the development of Carrot Health's COVID-19 Risk Index, which has an interactive dashboard that allows users to view and analyze data to identify pockets of risk and model outbreak scenarios, informing public health and intervention decisions. Longer term, Kurt is focused on applying Carrot Health's data to address the public health and public safety issues created by the disparities that were revealed during the pandemic and after George Floyd's death. This includes working with neighbors and elected officials to figure out ways to alleviate the systemic conditions that were exacerbated by the dual crisis. Here's Kurt.
While we didn't fully recognize or take advantage of it at the time, my bright spot was the opportunity to slow down, to take time out of a hectic life, both professionally and personally, to enjoy family, to be present in the moment. Without travel, without full schedules, I was able to spend more time at home, to enjoy more meals with all three of my teenagers, more than ever before, to spend time outdoors, to see the world in small and local panoramas. As the world is ramping back up to warp speed, I hope we are able to hold on to that quiet, that corner of our lives where we are insulated from the always-on demands. Yet this luxury comes from privilege, financial security, work from home without underlying health conditions that put others at elevated risk. This privilege was not universal, and holding on to those insights about inequity that the pandemic laid bare are critical to improving the world around us. You know, for me, never underestimate the resilience of our community, of our friends, our family, and our neighbors. And the question of why does it take a crisis to understand how strong we are together? A community responding to shared tragedy, the local efforts to first survive and then thrive during a global pandemic, the outpouring of grief after the George Floyd murders and the corresponding demand for change, these highlight the persistence of the human spirit of our collective will. It is in these dark hours that we learn to stand together, shoulder to shoulder, to make the world a better place. This is where we find our hope. And our generation, our world, will be the better for it. Thank you.
Thank you, Kurt. Our next category is Health Equity Champion, and first up in this category is Jalila Abdul-Brown, manager at Hennepin Healthcare in partnership with the Minneapolis Office of Violence Prevention. Jalila was once a homeless single mother. She worked tirelessly to get her bachelor's degree in childhood psychology and administration of children, youth and family programs from Metropolitan State University. She has launched the childhood organization Train Up a Child, became a pastor, co-founded the Shiloh Cares Food Shelf and Outreach in North Minneapolis, and is now a violence prevention specialist and case manager for Hennepin Healthcare's Next Step program in partnership with the Minneapolis Office of Violence Prevention. Her team has served 500 people who came to North Memorial Hospital and Hennepin Healthcare after being shot, stabbed, or assaulted. They work holistically to help people create a new path to avoid re-injury and recidivism. Her focus is on health equity, nutrition, mental health, violence prevention, and helping the Minneapolis community heal from trauma. She also has worked with Governor Tim Walz to get COVID-19 vaccines to North Minneapolis. Let's hear more about her.
A bright spot for me in 2020 were bringing vaccinations to the BIPOC communities in North Minneapolis, and then also opening up a food shelf in the middle of a food desert in North Minneapolis on West Broadway. That food shelf is now serving over 4,000 individuals monthly. That has been brought me one of the greatest joys, to see children and families not go to bed hungry. I think people would be surprised to know that I really love interior design. I'm like a huge DIY girl. I will take an entire room apart and put it back together. I really like getting my hands dirty and making things that were maybe not so cute, beautiful.
Great work, Jalila. Our next honoree is Elwipa Kocher, cultural broker for mHealth Fairview and the Caron Organization of Minnesota. Throughout the pandemic, Elwipa has been a lifeline for the Caron community, which this past year has combated higher than average COVID-19 infection rates, exacerbated by the pre-existing healthcare barriers. A refugee herself, she has worked since 2017 as a Caron cultural broker with mHealth Fairview. Employed by the health system, she works out of the Caron Organization of Minnesota and lives in the communities she serves. In this role, Elwipa connects clients to physical, mental, and chemical health resources. She accompanies them on clinic visits, translates medical information, and helps with online insurance applications. During the pandemic, she has taken a holistic approach to health-related inequity. She sits down with families recovering from COVID-19 and job loss, translating and helping them complete assistance applications. Here's Elwipa.
Personally, I was able to serve my community efficiently with the support from the amazing culture broker leadership team and all the amazing communities out there in the Twin Cities. I was also spent many quality time with my family. Professionally, I participated in a few trainings that provide information regarding mental health. One of the training provides us with how to take care of ourselves mentally while taking care of others. I believe I am the only 51 years old woman in Korean community who going back to college and study in drug and alcohol counseling. After graduating next year, I'll be happily serving the Korean community in the Twin Cities as a drug and alcohol counselor. My older daughter, who is also studying at U of M, will be graduating next year, and we'll be both graduating at the same time, and very excited about it.
Great job, Elwipa. Congratulations next go to Jeanette Rupert, COVID ICU nurse at Methodist Hospital and co-founder of 612 MASH. Jeanette began her career as an orthopedic nurse, but as the pandemic raged into 2020, she shifted her skills to the ICU. And then after the killing of George Floyd, she began helping out in a makeshift tent offering medical care for anyone who needed it, from bee stings to wounds. Out of this, she and her fellow volunteers were able to leverage their trusted relationships within the community to launch the nonprofit 612 MASH, which stands for Minneapolis All Shall Heal. A stable heated structure and a van stocked with medical gear provides basic medical care and education in the community. In addition to giving back to the community that raised her, the effort was also about being a Black medical professional in a community that may not be used to seeing Black medical professionals. Let's hear what she has to say.
The greatest accomplishment for me professionally has been moving to the ICU, working critical care in the midst of a pandemic. A bright spot for me in a challenging year has been faith, family, and crazy joy. Seeing my 18-year-old son graduate high school in the middle of a pandemic, but not only high school, with his associate's degree from North Hennepin Community College. Joyous. I mean, my 3 daughters all in their honor rolls in a pandemic. Joyous. But seeing all 4 of my children persevere in spite of ADHD, crazy joy. When I see that patient that's been battling and struggling with COVID-19 finally recover and get to discharge home to their families, crazy joy. Watching a community battle and navigate their grief and their trauma, come together with song and dance and build each other up. That's what community looks like. That's crazy joy. And when I see that brown-skinned girl that looks at me with my stethoscope walking down the street, and one day she saw me and I took my stethoscope and I put it around her neck. She looked at it. Game changer for a future career path for her? Maybe. But when she listened to her own heartbeat, I'm telling you, that was crazy joy. Thank you.
Great work, Jeanette. Our last honoree in the Health Equity Champion category is Shauna Hedlund from Minnesota Community Care. Shauna has been with MCC for the past 5 years, most recently as Director of Access and Advocacy. MCC provides affordable healthcare for the nearly 40,000 of the most vulnerable Minnesotans, including people of color, recent immigrants, people without access to insurance, and unsheltered populations. Shauna leads programs designed to address barriers to care and engages in legislative advocacy, ensuring the needs of these populations are met. As COVID-19 hit, Shauna's main task became ensuring access to care, a critical need for vulnerable patients, including unsheltered, uninsured, and historically underserved. Shauna helped MCC launch a full system transformation to immediately respond to the pandemic. A key feature of the transformation, including launch of telehealth services and drive-up pharmacy and lab services. MCC was also contracted to work with Ramsey County, staffing the respite centers that were created to provide care for Minnesota's homeless population. Let's learn more about Shauna.
In order to be a strategic partner at the cross-section of primary care and public health, Minnesota Community Care drove capacity building at our clinics, our shelter and public housing-based care, our school-based care, and in mobile delivery as soon as COVID swept into Minnesota. We anticipated that without strong prioritization, Minnesota's deep disparities in healthcare would reemerge in patterns of illness, loss, and economic impacts of the disease. Community health centers insisted upon being equity design partners in mitigation efforts because that is our landscape. We positioned ourselves at the epicenter of testing and vaccination and helped ensure that vaccine access was prioritized not only by disease patterns such as age, but specifically by race, ethnicity, housing, and wealth. Early on in 2020, I said often to my coworkers, we are standing on sand. Meanwhile, we have a plan A, B, and C, and one outcome is no more certain than another. I have a new perspective. Firm ground only limits our creativity. Change will likely never again feel so exhausting for this generation of the healthcare workforce. We rapidly adapted, and each success and failure kindled something for the future. Going back to what healthcare was before is not an option. The only thing I am firm on now is that health equity is more achievable today than it has ever been before if we choose to keep moving forward. Looking back at the turmoil of the past year, a bright spot stands out. At a community vaccine event at Neighborhood House in the Wellstone Center, our staff is positioned on a stage in their auditorium vaccinating patients. Patients were seated for post-vaccination observation in the auditorium seats. The array of Minnesotans coming by all day was exquisite. Couples in support of one another, immigrant women from Kenya, a local employer interpreting for his Spanish-speaking staff, Hmong elders arm in arm with grandkids, a Tibetan monk, and many for whom a larger, less personalized vaccine experience may present barriers. In this space, we had the opportunity to answer questions, address concerns, change some minds, and honor those who could not at this time. The space was respectful, welcoming, and warm. Some folks were teary with relief. An older gentleman who arrived with his bride of 10 years last Valentine's Day stood up slowly and hollered to the staff from the audience, "I just have to say something. Thank you for being here today. You are here because of love." Our staff yelled back, "We love you too." Treating people the way they want to be cared for feels good, both for those receiving care and for those who have the amazing opportunity to provide it.
Congratulations, Shauna. Our next category is Innovator, which includes Achin Haumick, Chief Technology Officer and Executive Vice President of Engineering at Starkey. Achin and his team are directly responsible for innovative technology Starkey developed during the pandemic that is helping thousands of people with hearing loss stay connected to their loved ones. People with hearing loss often use lip reading as facial expressions to help determine what a person has said. Masks take that valuable communication tool away. Working with Starkey's existing products, Achin and his team work to enable features to allow hearing impaired patients to better understand conversations with superior sound quality. He also led a team charged with expanding technology in remote programming, giving hearing professionals the ability to conduct virtual appointments with patients and, in some cases, make adjustments to certain hearing aids remotely without patients ever leaving their homes. Welcome, Achin.
I am extremely excited about our work at Starkey. I have the privilege of leading a talented global team of researchers and engineers to develop advanced products and technologies that help people hear better and live better lives. There is no greater satisfaction than to see the smiles and even tears of joy when you enable hearing impaired patients to hear and understand their loved ones and the world around them. In the challenging times during the global pandemic, our Livio Edge AI devices enabled hearing impaired patients to understand conversations with superior sound quality and AI-based edge mode for masks. It also allowed hearing care professionals to remotely adjust the devices via virtual telehealth technology when it was difficult to meet up with their patients in person. We moved very quickly to develop and introduce advanced technologies that help people connect with their loved ones during this difficult period, and I am very proud of that.
Impressive work, Achin. Also in the Innovator category is Dr. Chris Tignanelli. Chris is a trauma and critical care surgeon with mHealth Fairview and an assistant professor in the Department of Surgery at the University of Minnesota Medical School. He is a co-director of Minnesota Critical Care Outcomes research effort at the U of M, working to characterize and reduce the burden of critical care disease within the U.S. His research focuses on implementing strategies that use artificial intelligence and health informatics to improve healthcare workers' adherence to evidence-based practices. This past year, Chris made great strides in the healthcare tech industry. When the nation was facing supply chain issues and delayed turnaround times for diagnostic tests at the beginning of the pandemic, he jumped in to help and find a solution. Using his passion and expertise in AI and health informatics, he helped develop an algorithm that can read chest x-rays and diagnose possible COVID-19 cases. Let's hear from Chris.
The bright spot was being part of mHealth Fairview's COVID-19 Learning Health System. We saw unprecedented collaboration across the medical school, Institute for Health Informatics, School of Public Health, and Department of Computer Science to combat the COVID-19 pandemic. It was truly an all-hands-on-deck atmosphere. Research and clinical teams rapidly mobilized to launch projects to better understand this disease, identify new treatments, and develop decision support solutions to translate evidence into practice. My biggest professional accomplishment has been developing and leading the Minnesota Critical Care Outcomes Research Effort, or MinCore, along with Drs. Chipman and Ingraham. This group of 50+ researchers with a diverse technical skill set across the School of Public Health, Biostatistics, Computer Science, Institute for Health Informatics, the medical school, as well as external collaborators at UNC Chapel Hill and MCW, were instrumental in many of our accomplishments for COVID-19, namely launching multiple externally funded randomized controlled trials to test losartan, metformin, fluvoxamine, and ivermectin in COVID-19, and developing artificial intelligence solutions to characterize COVID-19. Our multidisciplinary team science approach to tackle research questions, I believe, is directly linked with our success. And it's really been an honor being leadership on this initiative.
Great job, Chris. Our next category is medical researcher, and congratulations to Dr. Susan Klein, a professor of medicine, infectious diseases, and international medicine at University of Minnesota Medical School, and an infectious disease physician at M Health Fairview. Susan has served on the front lines of the COVID-19 pandemic as an infectious disease physician with M Health Fairview and leading faculty at the University of Minnesota Medical School's Division of Infectious Diseases with the Department of Medicine. She was first in Minnesota to lead a clinical trial of remdesivir, the antiviral drug that has proven effective in treating patients with severe COVID-19 symptoms. Since that initial trial in April 2020, Susan and her team have led combination trials of anti-inflammatory drugs and immune-modulating drugs combined with remdesivir, showing strong patient outcomes along with improved survival rates. Susan's clinical trial work during the COVID-19 pandemic has been on the leading edge of discovery, and she has worked to share that knowledge with her physician colleagues regionally as soon as possible through educational seminars and community outreach programs. She's committed to ensuring that what she learns through the trials is quickly translated into better treatments for all patients during this pandemic. Here's Susan.
Professionally, I would say for me, a bright spot was being able to participate in the multi-center study, the adaptive COVID treatment trial. And that was a study that was run on over 60 sites in the US and internationally. And in the first stage of the ACT study, we tested the medication remdesivir and compared it to placebo or standard of care to see if it was better than placebo in treating COVID-19 infection in hospitalized patients. And that study did prove that patients that got remdesivir had a more rapid recovery than patients that didn't. And that ultimately led to that drug being approved by the FDA, initially for emergency use, and then later it became the first approved drug for treating COVID-19 infection. And so being able to contribute to that study was the most satisfying portion of the year. I learned from that study and from watching my colleagues in the hospital, what I really learned is that the power of people pulling together all for the same purpose, you can really achieve great things as a team of dedicated professionals. And for the ACT study, we had a large team of research staff, physicians, nurses, research coordinators, laboratory personnel, pharmacists, that really all pulled together and worked overtime to get the studies done. And that ultimately led to new knowledge and rapid approval of drugs to help us treat COVID-19. So I learned that when people pull together in teams, they can accomplish great things. Thank you.
Congratulations, Susan. Our honoree in the physician hospital-based category is Dr. Abraham Jacob, Chief Quality Officer at M Health Fairview. Abraham has been with mHealth Fairview for 16 years and serves as its Chief Quality Officer for the past 2 years. When the COVID-19 pandemic spread to Minnesota, he led the employee safety and infection prevention efforts. He partnered with companies like 3M and Clorox Healthcare to develop a new process for decontaminating N95 respirators during the PPE shortage crisis. He also worked to close COVID-19 vaccine disparities, expanding outreach to populations with language barriers, as well as those with limited technology and transportation access. He has been the face for mHealth Fairview, conducting interviews to promote COVID-19 precautions and provide vaccine information. Abraham has also been a pediatrician, internal medicine physician, hospitalist, and assistant professor in the Department of Pediatrics at the University of Minnesota. Let's learn more from him.
Looking back over the past year, one of the highlights, personally and professionally, has definitely been having the privilege to work closely and intensely with my teammates, colleagues, and leaders across the health system. It was truly inspiring to witness how they met the daily challenges of the COVID pandemic. There were many models of courage in how they stepped up to protect our patients and each other. There aren't many leadership challenges like the ones we faced in the past year, and I will forever be grateful for that. One of my biggest professional accomplishments has definitely been the relationships I formed over the years and helping to build the mental model to improve the safety of our patients and staff. I will always be grateful for these relationships, and like myself, I hope in some small way, the folks I've gotten to work with have found more sense of purpose and, more importantly, joy in the work.
Congratulations, Abraham. Our last honoree is in the physician non-hospital based category. Congratulations to Dr. Sarah Traxler, Chief Medical Officer at Planned Parenthood North Central States. During the global pandemic, Sarah and her health services team sought to keep Planned Parenthood health centers in Minnesota open and caring for patients while implementing public health measures that kept patients and health center staff safe. When the governor's executive order suspended some healthcare services temporarily, Sarah and her team worked tirelessly to come up with new ways to reach patients during the pandemic. She led the team to launch telehealth services, gender-affirming hormone therapy via telehealth, at-home sexually transmitted infection testing kits, and at-home HIV testing kits in Minnesota, plus anxiety and depression medication, management, and curbside prescription pickup. Even now, as they've returned to full services in clinic, telehealth services account for nearly 10% of patient visits at Planned Parenthood. Please welcome Sarah.
When I look back on all of the struggles and challenges over the last year, it's hard to find bright spots, but there are a few that I can point to. One of them is personal. Even though we were separated from a lot of people that we love, we did actually, as a family, get to spend a lot more time together, which I know for those of you who have teenagers understand how valuable that time can be. And we were able to sit down and enjoy meals together and have really important discussions about everything that was going on in our communities. So that was really one of the bright spots that I can tell. Professionally, really for Planned Parenthood, it was keeping our doors open, making sure that we continue to be that beacon of hope for all of the people who rely on the expert care that only we can give. One of the things folks might not know about me is that when I graduated from college, I moved to Austin, Texas, and joined AmeriCorps Vista. Soon after that, I met my to-be husband, Billy, and during the course of our time in Austin, we decided to travel to the Panama Canal and back. So we drove our pickup truck from Austin around Central America. We didn't really have a set plan, and one of the places we ended up was in Utila, an island off the coast of Honduras. While we were there, we met an expat who had opened a beach volleyball bar, and he was hiring, and he asked us if we wanted to stay, and we actually considered it. Looking back, I'm pretty glad that I didn't stay off the coast of Honduras, as wonderful as that sounds, but I'm pretty sure I'm much more fulfilled today doing what I'm doing now than hanging out on a beach in Honduras.
Great work, Sarah. Wow, I am truly in awe of all of our amazing honorees today. Thank you for your dedication and compassion to work to improve the human condition, and congratulations again. To read more about all of our honorees, please check out our Healthcare Heroes special section, which publishes in the Business Journal tomorrow, June 11th. We will put a link to an advanced digital copy in the chat. Before I leave you today, I would like to give one more thank you to our sponsors. Thank you to all the companies whose logos you see on your screen. Let's give them a virtual round of applause. Thank you so much for joining us today, and I hope to see you soon at the next Business Journal event. Enjoy your day.